Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. In the first few months of 2025, health officials have reported measles outbreaks in multiple states, placing the U.S. at its highest number of cases since 2019. KFF's survey results indicate about half of adults and parents are at least somewhat worried about the outbreak, and most adults and parents say they've read misinformation or heard false claims about the MMR vaccines. In the last few years, childhood vaccination rates have declined while exemptions have increased, which is being cited as a factor in the outbreak by healthcare authorities. Vaccination clinics have been canceled across multiple states due to funding cuts to state and local health departments, which we covered in last week's news update. On to the damage report. 4 hospitals have closed between April 21st and 22nd, placing the number of U.S. hospital closures at 15 this year. The 4 closures reported last week include Orlando Health's Rockledge Hospital, which eliminated 940 jobs, and Midcoast Medical Center in Texas. The other 2 closures come from Crozier Health, a system in the process of shutting down completely. Other hospitals and health systems are eliminating jobs, including UMN Health, which recently cut 52 leadership positions, including many C-suite roles. Prime Healthcare in Ontario, California, is suspending pediatric inpatient services. Many hospitals have frozen non-clinical or all hiring as they battle the worsening economic climate and various funding cuts. When communities lose access to local health care, they not only lose essential health services, but also economic anchors and their long-term sustainability as a thriving community. And now for today's success story. Walgreens Pharmacy serves millions of patients, and now they're aiming to improve their talent pipeline with a new program called Farm Start. This program enables an eligible Walgreens pharmacy technician to pursue fully funded online farm degree. According to Walgreens, the program was prompted by surveys resulting in an indication that financial challenges and time constraints that the pharmacy techs were facing in pursuing advanced education were a barrier. The goal of the program is to provide the support that techs need to earn their PharmD degrees and cultivate talent on their team for long-term impact. As a workplace that also helps our employees pursue education they need in advance, Hillsdale Hospital applauds efforts like Farm Start for their vision of the future of healthcare. Thank you to our sources for this episode: KFF Health News, the CDC, Becker's Hospital Review, Forbes, and Fierce Healthcare.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.